proton pump inhibitors or PPI. So their mechanism of action, they irreversibly block the proton pump. And so what does that mean is that for the duration or for the life of that proton pump, the PPIs will permanently block those or inactivate those pumps until the body creates or synthesizes new proton pumps. Second, this stops hydrochloric acid production. So as a result, the therapeutic effects include decrease in hydrochloric acid production, decrease in heartburn, or pain symptoms of heartburn. Some precautions include hepatic disease because this medication is metabolized in the liver, as well as use of Plavix or clopidogrel because there's some evidence that suggests that this may interfere with the action of clopidogrel, which basically diminishes its antiplatelet effects. Contraindications, severe hepatic impairment, because again, this is metabolized in the liver and sometimes taking this medication can worsen somebody's liver function, especially if there was an existent hepatic impairment to begin with. And obviously, if there's any allergies, then that's also contraindicated. Next are side effects. Side effects include possible GI infection, right? Because we're disrupting the acidity of the stomach. And remember that acidity is also a protective mechanism for infection. So once we mess with that acidity, the risk for infection can go up. Next is relationship to hip fracture. And this is mainly when PPIs are used long term because this medication is shown to speed up the mineral loss, specifically calcium, and this can lead to osteoporosis. And as we know, if a person has osteoporosis, they are at a higher risk for developing fractures. Nursing actions, like always, we need to assess for therapeutic effects as well as side effects. And in addition, definitely it's important to do our patient education. It is also very important to take this medication on empty stomach, especially 30 minutes before ingestion of food, so that the medication is going to be more effective. Drugs that we have to remember in this class are the ones with the parentheses, so those are your prototypes. So you have Prevacid or lansoprazole, Prilosec or omeprazole, Protonix or pantoprazole. So the most common medication that you will see in the hospital setting or acute care setting would be your pantoprazole. Notice all these medications, they end in prazole, right? So prazole or proton pump inhibitors.